Good morning, everyone. It's a beautiful day out this morning. I hope you got a chance to step out a little bit and feel good, get the fresh air. I did, and it was really exciting. By the way, how many of you were here yesterday for the session? Very good. I'm glad you're back because this will be another exciting day. And I hope you enjoyed yesterday. By show of hands, how many did you enjoy being here yesterday? What kind of sessions did you enjoy the most? Which ones? Name them. There you go. I love that. What else? All our panels were wonderful. They gave us, yes, sir, you were raising your hand almost. You were there.
I think responsible AI.
Responsible AI. Yes. It's very important to think about using AI responsibly, and that's one of the pieces of topics we'll be discussing this morning, so I'm glad you brought that up. Beg your pardon?
The physician's perspective.
Absolutely, yes. They are really at the front end. They're practicing. They have to deal with the patients. It's utterly important for us as a complete ecosystem to enable them to serve the people we are here to serve. That was an excellent conversation. Thank you, Dr. Deepthi Pandita. That was an excellent conversation. Thank you so much. What else did you enjoy? I just want to get some feedback. I want to be sure that we are on the right track. You see, we've been here, this has been in making for a couple of years. As we've reached out to people from different walks of life within the healthcare ecosystem, one thing was coming very loud and clear, that we are, as Senator pointed out, at the cusp where AI is now enabling explosive opportunities for innovation and transformation. But at the same time, the things that we need to think about, prepare for, and be cautious as we deploy these new powerful technology solutions and operationalize them in the real world scenario. So having said that, the important piece is three things. Number one, and that's what I picked up listening to all the speakers yesterday, collaboration. We just have to collaborate and think differently. We just cannot be going singularly on our own specific agendas. Second piece that was very loud and clear was integration. There needs to be technologies being introduced, new technologies are being introduced. Is there integration? Is there adequate leveraging of the existing technologies as well as new solutions that are coming into the marketplace? And the third piece was preparing the workforce, people. It's about the people at the end of the day. It's internal transformation for organizations as well as changing the mindsets and working with the people in the ecosystem itself. There's one issue that has been loud and clear that we've heard over the last couple of years is policy-making process. It's extremely important because when it comes to AI, policymakers from local levels to state level to federal level are thinking about what should be the laws, how should we contain misuse. But they're also thinking about how to unlock the power and potential of American ingenuity. We cannot stifle innovation. So this morning we have a panel, which is a very interesting and exciting panel, and I'm really honored and pleased to have some of these distinguished speakers here with us. We have Senator Eric Lucero. He's here. I'm going to ask him to come up. He's a state senator for the state of Minnesota. And by the way, he's a citizen public servant. He is in the legislature by day, and at night he works like a cybersecurity expert. Is that correct?
Correct, cybersecurity professional.
Expert, I would say. Have a seat. Then we have Representative Steve Elkins, again, citizen legislator who's serving the state, but at the same time, his passion is privacy laws. He is the father of the privacy law in the state of Minnesota. Steve, thank you for being here. Then my colleague and dear friend, Commissioner Tarek Tomes. He's the CIO for the state of Minnesota. He oversees for the governor the implementation of AI solutions across Minnesota government, as well as he's a leader in the AI, in the CIO community and knows very well what's happening all across the country in other states. So he's going to tell us more about that. And then we also have a panelist who's come all the way from Washington, D.C., from the Bipartisan Policy Center. She's going to tell us what this great organization is all about. It's based in Washington, D.C., has been focusing on broad array of issues over the last 10, 20, 15 years since they were founded, focusing on bringing bipartisanship to Washington, D.C. on broad array of issues. And right now, Katie is heading the AI piece of that policymaking process in Washington, D.C. So with that, please welcome our guest this morning. So let's start with the, and by the way, as we are talking, please take a moment to write your notes, your questions, what's coming to your minds, and we'll ask these people those questions. And don't be bashful. We'll make this into an interactive conversation rather than just a one-way conversation, so that they can ask each other questions as well, follow-up questions, because they're coming from very different perspectives. Let me quickly start with Katie, you first, because everybody is saying what's happening in Washington, D.C. It is always such a mystery as to what's going on there. So just give us an idea, on what is BPC as an organization, so that our guests can understand better the work of the organization, and what you're hearing in Washington, D.C.
Well, I'm so glad to be here, and thank you for the invitation. And it's true, everyone always asks what is happening in Washington. I'm not sure if they know. For those not as familiar with BPC, we are a nonprofit that's based in Washington, D.C., that works to help policymakers from both parties come together to craft durable, workable policy. So we don't ask anyone to abandon their party views. We focus on finding the middle space where people can negotiate. We blend policy ideas and build solutions that can actually pass and hold up over time. And that's especially important in a space like AI, where the technology is moving really fast and the stakes are high. And frankly, the only way we'll build frameworks that can survive multiple administrations is if both sides have a hand in shaping them. So my role at BPC is to bridge that, translating what's happening in healthcare and technology into the kinds of policy questions Congress and the states can act on. So I started my career in the Senate, and that means I've seen how legislation gets written, how it's debated, how it's held together with duct tape. And AI brings a really different kind of challenge to Washington. Normally, Congress has time to study an issue, have hearings, hold hearings, draft questions, and go through the intentionally slow and deliberative process that is the United States Congress. With AI, by the time the hearing is scheduled, the models may have versioned twice, new use cases have popped up, and half the staff briefing memo is already out of date. So that gap between the speed of technology and the pace of policymaking is where the tension lies. But it's also where a lot of opportunity is.
So there's a lot of chatter about the current bill, the big beautiful bill, that has language. Can you tell us a little bit about that?
Yeah, so currently the House passed a reconciliation bill, which does include a 10-year preemption ban for the states. So I'm sure a lot of you are familiar. A lot of states have been introducing legislation related to AI. And it's a House-passed part of the reconciliation bill. It now has to go to the Senate for consideration. And this is all obviously speculation because I dropped my crystal ball. So I can't tell you for sure, but I can say that there are some, once it hits the Senate, which it has, the Senate has rules and restrictions around what can be considered, namely the Byrd rule. and named after former Senator
Byrd.
Robert Byrd. And it says anything in the bill that's not related directly to budgetary concerns isn't germane and should be dropped. So the preemption may be dropped in the Senate version. The Senate Commerce Committee has introduced some draft language that says we might drop the preemption, but we might tie funding for broadband to states and whether or not they do AI-related legislation. So that's where it currently is.
But Katie, what is germ of the idea? What is the language seeking?
The language in the House,
Yeah.
It says that for the next 10 years, states cannot enforce any AI-related legislation.
Representative Elkins, that'll be blasphemy from your vantage point, isn't it?
I think this is on. Yeah. Okay. Yes, it would be blasphemy. In fact, 500 state legislators from around the country, half Republican, half Democrat, have already signed on to a letter but basically saying, it would be one thing if, Congress, banned states from regulating AI if they were actually doing something about it themselves. But Congress can't punch its way out of a paper bag right now. So to say, we're not going to regulate AI and states you can't do it either, it's just ridiculous. It would outlaw existing state laws we have here that ban deep fakes in elections or revenge porn. I'm not sure how it would affect the provision that I have that protects consumers' rights with respect to the data about them that's used to profile them. So at the state level, state legislators from around the country have rallied in opposition to this provision.
So just a word of caution. So when you go back to Washington, D.C., you can let your friends know, right?
Oh, no, they're
Steve Elkins
definitely
is,
aware. The states are concerned. Yes.
But coming back, Katie, one more question. You're tracking the bipartisan AI caucuses both in the Senate and the House. Tell me a little bit about that composition. How active are they? Because sometimes these caucuses get set up and the activity, I wouldn't say it's mysterious, but it's not quite self-evident. So just tell us.
Yeah, so in the House and the Senate, there are a couple of bipartisan caucuses and working groups. The House Bipartisan Working Group put out a report in December, which laid out a blueprint for how they're thinking about AI. This is not health specific, but AI specific. And then the Senate also had a bipartisan working group. They put out a blueprint as well, again, kind of a general how we're thinking about AI. There are senators who are still working together pretty significantly on AI. The Health Tech Investment Act was just introduced by Senators Rounds and Heinrich, dealing with Medicare payments for FDA-approved devices for AI-enabled tools. So there is action taking place still. And a lot of members are really, deeply engaged in asking serious questions. I think there's some are really bullish on AI. An office recently told me they're using ChatGPT to write constituent mail, and some are very, very cautious. But there is still, active hearings and bipartisan work happening, and so I think the working groups and the caucuses are actually some of the ones that are doing the work. Yeah.
And what are you hearing or seeing coming from the White House? Yesterday, by the way, we got a briefing from the Principal Deputy Assistant Secretary, Steve Posnack, talking about HHS IT policies and AI policies that they're constructing. What do you see coming out of White House?
Yeah, I mean, the administration put out, and yesterday they talked about some of the executive orders relating to AI, and there's a real hunger for figuring out how to use AI in government. In terms of how AI is done by HHS, and other, health-related, agencies. It's kind of a dual-edged. There's a real hunger to figure out how AI works, but also we're seeing, staff reductions in, the FDA. So, still trying to kind of figure out what that looks like with this administration, but is certainly something that I think the White House has said they're very excited about AI and how it can be used. The FDA just put out, and briefly I think it was talked about, ELSA, which is an internal FDA AI that can help, they're saying, with the review process. CMS has talked a lot about how they want to potentially use, AI further to help. They put out 2 RFIs recently. So if you guys are all working on the RFIs as well, looking at, how do we use technology and AI to, deregulation. So internally, there's interest as well.
So, Katie, if I understand correctly, the White House policy initiatives are going to be focused most on the workings of the government, how AI is used in government, correct?
So, it's twofold, but right now, yes, it's,
Okay.
a lot of what we're hearing is how AI works in the government. But, there's been talk of investments in AI research, investments in, AI technology, but I think we're still waiting for specifics on that.
Well, I'm glad we have the top IT executive in state of Minnesota government, Tarek Tomes, the commissioner. What do you think is going to be the governor's agenda for you to use of AI in state government?
Well, thank you, Gopal. This is, for me, a really fascinating conversation. I'm a member of the governor's cabinet, have been a part of this cabinet for approximately 6 years, which is probably 4 years longer than I expected it to be. My wife is a physician, my oldest son is a physician, and really thankful for being on this panel with these panelists, Senator Lucero and Representative Elkins. So there's no chance that I am going to say something that someone is not going to broadly disagree with. Most likely my family members. From an AI perspective, we're really lucky in Minnesota as it relates to government, and in the sense that we have a really close and thriving community in relationship with private sector organizations throughout Minnesota, in particular in the Twin Cities, and healthcare organizations that really allow us to get a lot of broad perspectives from a lot of a variety of industries, whether it's the banking sector, retail sector, the healthcare sector, that helps to form our thoughts and opinions. We have a advisory committee, the Technology Advisory Committee that Representative Elkins participates in as well, that includes private sector CIOs, that includes open to the public, and one of the subcommittees that we have is a subcommittee on artificial intelligence. We started artificial intelligence work within the executive branch years ago, probably 2-3 years ago, and really formalized it. Our efforts, it's branded as TIGA, Transparent Artificial Intelligence Governance Alliance, and it is really strongly thrived. And it started off with really foundational steps a couple of years ago. Let's create a policy for the 40,000 executive branch workers that allow people to really broadly understand what are our aspirations just from an administration perspective. What's our approach? How do we approach this emerging, changing set of capabilities? Certainly a governance structure that is transparent, that allows for the public to see and understand where there are artificial intelligence implementations and things that the public can weigh in on. And then that vision where we broadly kind of share with everyone what our view and approach is. And we're very optimistic as it relates to the opportunities in a cautious way, if you will, or in a very mindful way as it relates to the potential inequities that these tools introduce, the need to make sure that we protect Minnesotans' information, that we are very responsible with what we do and how we approach that. our policy as it relates to executive branch workers, really was one a couple of years ago that was explore, learn these tools, learn these capabilities, see where there are opportunities in government to implement and use these opportunities. Two exceptions. One, don't let it make any decisions on its own. And two, make sure that personally identifiable information is not in places where public AI capabilities are used. And so it was an effort to really encourage our workforce to go play, because innovation really happens at the edges. And so putting these tools and capabilities in the hands of people. Now, we've come a long way since then, where we have really comprehensive examples where AI can really make a big difference. For example, we funded an effort to try to predict the best place to idle emergency response vehicles, in particularly in outstate locations, recognizing that idling them in the garage where they're home isn't the ideal place to respond to a significant automobile crash. And when emergency response vehicles get there within a certain period of time, the chances of someone surviving go up dramatically. AI allows us to pull in information from a lot of different places, traffic patterns, events, weather, so forth and so on, to predict various times of the day where something, and it's kind of in its infancy, but the type of promise that we feel really strongly we have a responsibility to continue to explore what these tools and capabilities could represent. One of the things that I think in this AI conversation, Gopal, is really important is to not paint everything broadly as AI, but really think about the different categorizations or classifications. And in Minnesota, with our administration, we really model the work that we do after the autonomous vehicle space. If you think about a level 1 versus a level 5 autonomous vehicle, level 1 is the type of vehicles that are kind of modern today that have, adaptive driver assisted driving and so forth. There are a lot of AI opportunities that can improve people's outcomes, in particular in healthcare, that are level 1 and 2 opportunities, that are not the AGI, that are not the scary AI opportunities yet.
So, yes, sir. Representative.
Just to build on that just for a second, I'm a member of a national group of state legislators that work on cybersecurity, data privacy, and AI legislation. In the last meeting in Tampa in December, I had the opportunity to speak with Doug Robinson, who was the president of the National Association of CIOs. And I asked him, Doug, I'm seeing other states that are passing laws regulating the use of AI in government. Does Minnesota really need to do that? And he said, no, I think Tarek might appreciate having the legislative authority to tell the other commissioners that they have to follow the TIGA policies. But he said, otherwise, no, TIGA is a model that is being used by other states as a template.
Very good to know that, Commissioner. Thank you for all the good work you're doing. My question to you is, as you are going about letting people learn, implement, experiment, and make it better, are you seeing improvement in operational capabilities? Where is your biggest gain going to come from in terms of using AI tools within the state government?
That's a great question, and I think they really are in almost all aspects and all facets. Certainly at the heart for government as it relates to being responsible and stewarding taxpayer funds towards the various services that government provides. Data is kind of at the core and at the heart of that, and being able to use AI capabilities to really analyze information and data in ways that you previously couldn't, really across all spaces and business segments, to try to bring forth better outcomes is super important. If you think about the child welfare space and the opportunities that analyzing data may represent for kids that are in the child welfare system to find better opportunities for those children to meet their unique needs. And we see that really in all spaces, but certainly the automation of things, the efficiencies that AI brings about, the ability to connect with constituencies in different ways, that connector of being able to bring multilingual capabilities where people can interact and understand laws in a different way. One of the things that we did with AI this session is we have AI capabilities that analyzed all of the prospective bill language as it relates to potential tax and or IT implications. And as these gentlemen know well more than me, there are literally thousands of bills that navigate a particular legislative session, with most of them, not ending up necessarily going anywhere. There was previously no way to analyze thousands of bills that change, sometimes, on a daily or a weekly basis. We used artificial intelligence to automatically analyze these bills. We were analyzing hundreds of bills per hour, producing summaries that alerted us to areas, where we may want to provide more information or more data to inform better laws that, could potentially be considered. So just an easy example of some of the efficiencies.
So Commissioner, I'll come back to that's brilliant. Two things you pointed out. One, you mentioned data, and then you mentioned child service as a service offering, right? And coming back to data, right now in government, when it comes to different programs, you cannot share data. And if the data is not being shared, you really cannot get a complete or a better or different picture of the citizen we serve. So isn't data sharing an issue and a challenge because there are old laws that prevent sharing of data from one siloed service to another one? But wouldn't that stymie the possibilities of using AI?
I'll take the beginning of it, and I'll hand the latter part, to my legislative friends. I wouldn't say that data sharing isn't possible. I would, in my somewhat limited experience in public sector, say that data sharing is complicated, that it is not as easy as it should be, and because it's not as easy as it should be, the outcomes that can be achieved are always delayed, and there are inefficiencies that are created. An example of this is the summer EBT program that provides food benefits for children. A couple years ago, maybe, 2-3 years ago, law was passed that allowed you to use Medicaid certification information as a way to connect kids in the school system with food benefits for the summertime. So data that was held in Human Services, Department of Education, that provides those summer EBT cards. And we did connect those data sources, and we provide food benefits to hundreds of thousands of children that would not have had food benefits in the summertime. Obviously, during the school year, they have better access. But the time that it takes to write those data sharing agreements, a child is hungry. And so creating those avenues where you can safely share data in a more efficient and effective manner, whether it's healthcare. Certainly, all of us lived through the COVID times with the healthcare community really being expanded and needing unprecedented speed as it relates to the sharing of test results and where things were happening. And and unfortunately, from at least from my vantage point, we've kind of taken our foot off the pedal a little bit as it relates to the technology opportunities that probably exist to create a broader capability to share information that is important to different organizations in a faster way.
But isn't that a problem, Representative Elkins, that technology is moving much faster while our rules and regulations are sort of hampering or coming in the way of data sharing? Just to stick with this example, why does it take so long? Why can't we revisit the laws and say, can there be some removing of those legal barriers that were created, not for any wrong reasons, but to protect the data, protect the citizen information. Mm-hmm. But in the new world where data is flowing anywhere and everywhere, should we be rethinking our privacy laws?
We are rethinking our data sharing laws. So Tarek didn't mention it, but the Technical Advisory Commission that he mentioned earlier, we have now established a data sharing subcommittee that is been meeting for about 6 months now, and we're starting off by looking at first what are the legal barriers, what are the things that are either in state or federal law or just have become customs, whether they're in law or not. And we're looking to kind of sweep some of those barriers away. Actually, I have a picture on my phone now of a first draft of an enterprise service bus that would describe all of the pockets of data that in individual agencies that are useful to other agencies that we could put together, so that you might, if you're evaluating a citizen's eligibility for a means-tested program, you would just fire off a data service request to the Department of Economic Development saying, get this person's current employment and status and income. So we're already working on that.
So now, as the data gets unlocked more and more, Senator Lucero, what become, from your vantage point, what are some of the things we should be thinking about from a cybersecurity perspective? As more and more data is available, what do you see as issues coming up relative to, again, AI, healthcare, but data being unlocked?
So the first question that we have to ask ourselves with any data is, who owns it? Who owns the data? That's the fundamental question that has to be answered. So if we think in our own lives, for those that might be married, in order for my wife to gain access to my data, I need to give affirmative consent, even for my spouse to see my health record or to share a certain subset of my data. If we have that recognition that the individual owns the data and that affirmative consent must be given even to their own spouse, certainly that mindset then is going to carry over to the government. So in my opinion, and the opinions of many, the relationship between husband and wife is closer than the relationship between individual and government. And if we need to have that consent between husband and wife or spouses, certainly we need it between government. So I am among those that would not be comfortable just erasing these old protections that may have been on the books for decades and that prohibit the data share, because unless there's affirmative consent, I'm not comfortable with government going in, data mining information on myself, sharing it among themselves. Within the field of cybersecurity, one of the foundations of cybersecurity is the principle of least privilege. And that means give the least amount of access necessary to do the job. So who defines what the job is? Who defines what that minimum level of access is? And then how do you enforce it? And then how do you ensure accountability when there's violations or breaches of that data? So those are among some of the considerations. And just to give a real world example then of the principle of least privilege, within the healthcare space, imagine a high profile individual. Could be a sports person, could be anybody who they have an injury of some kind, they need a hospitalization, they go in. And we've seen stories over the years of nurses or other medical professionals that are not even involved. They're not helping the patient, but they have access to their record, right? They're nosy and they want to snoop and they want to see. That is an example of violation of the principle of least privilege, ensuring that only those who have access, need to have access, do have access, and everybody else does not. So that's one thing. And but it certainly is important. The more information we have, the greater visibility, the better the conclusions can be reached on whatever scenario is. So if a person makes the choice that they want their economic or employment or job data to be, so the Department of Revenue would have income and perhaps some other information, should that be shared just automatically without consent to the Human Services Department or to other departments across government? I'm among those that says no, unless there is consent. If there's consent, fine. But then again, it comes back to, is consent necessary? And there's disagreement among policymakers and among the population on the answer to that question. Also, there's disagreement on who owns the data. Is it the person or is it the organization or entity that's collecting the data? Because they're the ones that are going through the effort of collecting the data, data mining the data, storing the data. Are they the ones that own the data? And they can just have free reign with what they want to do with that, including government, sharing it, et cetera. The other, and just real quickly before I get the microphone up, I want to go back to one of the first questions that was asked was the preemption. So as a state, so the federal preemption or prohibition on regulation within a state. So as a state legislator, I'm a strong proponent of states' rights, a strong proponent of the philosophy of laboratories of democracy. That's the function of a state, so that we aren't doing the same thing to allow for some states to do it good, some states to do it bad, and other states to learn from the pros and cons then of how other states are doing it. At the same time, there is a need for a higher level controlling entity to provide some standardization to help foster that innovation. It's a tricky balance between limitations and creating guardrails or standards that help to foster innovation. And one example I'll put out there, let's just say our interstate freeway system. So here we have the federal government creating the standards for this. We drive so regularly, most of us in here, that we probably take it for granted. But the width of a lane, the color of the stripes on the pavement, the type of pavement, the thickness of the pavement, the length of the acceleration or deceleration ramps, all these things are standards that are then applied to create some uniformity across the country so that those of us who are users, now, you as a user, you have the voluntary choice to be a participant in the interstate freeway system. You don't have to get on it. You never have to use it. You could use the back roads. But when and if you make the choice to use it, you are then the beneficiary then of those standards of this higher level entity, the federal government having created this to allow interstate travel, right? But now when it comes to artificial intelligence, if it's the Wild West in standardization, the same choice is not there. You, unlike the freeway system, you can choose to get on or not, on or off. When it comes to artificial intelligence, each and every one of us in this room, we are not given that choice. We are going to be in the system, and it's going to be used. The question is, are there going to be a multitude of standards? And think of all the other standards that have gone on. So one of my favorite classes when I was at the Carlson School of Management, I was a student there, was a history, not necessarily history, but examples of some of the different standardization battles that took place, such as Beta and VHS. How many remember that, right? When the VCR was coming out. I see there's so many hands in here that have no idea what I'm talking about. How about another standard? Blu-ray, and I forget what the other one, laser? Was it laser and Blu-ray standard? There were two different, when the technology had innovated from VHS, magnetic tape, to disc, right? There were two it's a standardization battle. And here you have two private sector companies in a race to have their technology be adopted as the standard. And in that race, and being one who's been in the cybersecurity industry for over 2 decades now, I've seen firsthand when it comes to the development of application in the race to bring something to market to get wide adoption and therefore become the de facto standard for a particular industry, there are many corners that are cut. Many corners that are cut. So in this race for artificial intelligence, when there is no standard right now, there is a race happening. And corners might be cut. They might be ethical corners. There might be a bunch of corners that are cut to try to become the leader in the space. And that is going to then pose a significant challenge to the question you asked, which is, what are the considerations for privacy? And again, it comes back to who owns the data, and is your consent necessary for your data to be involved in artificial intelligence processing?
So today we are either by consent or just abdicating that responsibility, unlocking our own personal data, which is all over, right? It's readily available to anyone who is willing to scoop that data, correct? So if data is already liberated, personal level, why is this debate between privacy and what's important to me? Is the American public not yet ready to rethink what is my private data versus what is not? Because they're already unlocking their own private data.
So the act of unlocking our own private data, that's exactly correct. It's a convenience factor. I suspect if I were to ask, most in this room would say, I want my data protected. I have that as a high value set, that my data is mine and I should have control of it, or ownership, or at least a say. But then when you weigh that against the convenience of the mobile phone, and if you use GPS, or there's so many conveniences in many different apps and many of the different technologies across our life right now, that we have made the choice out of, it is because I value the convenience that I gain more than I value my data, I'm willing to make the choice, the trade-off, to let my data go out there, and once it's out in the world, it's there forever. I'm making the choice to have Facebook app on my phone because I value being able to be connected and be part of the social networking community more than I do my own personal information. Understanding, but so those may not have made the conscious choice, knowing, and this gets to your question, if the data is out there, why do we still go through these exercises? Well, the reality is most have not gone through that conscious choices I just laid out. They didn't actually consider that. And therefore, the data that's out there, people still want to have a choice. And even though the data is out there, and then I, as a policymaker, here's the balance that I have to do. So as a policymaker, I'm an elected official, elected to represent the values and priorities and voices of my community, or the 80 or so thousand people that I represent. Is my responsibility to make decisions as a leader, even though it might be contrary to them, and I'm going to make the choice of what's going to be in their best interest, and therefore allow for making changes to statute that free up data protection? Or is it my responsibility to be responsive to those voices, and if they value the continuation of the protection of the data, to maintain those statutes in place? And that therefore then potentially becomes a hindrance of innovation in the future. So
while this debate or this conversation goes on, Representative Elkins, you as one who's responsible as an elected official to protect the interests of the citizens, have to think about privacy laws and have to think about making sure that the guardrails are there, but we do not stifle innovation in the age of AI.
Yeah.
What are your thoughts? How are you dealing with that conundrum?
Minnesota is now one of about 20 states that has a comprehensive consumer data privacy law, and I think it's a good model, and it helps inform the debate related to AI as well, because 19 of the 20 states that have so far passed comprehensive consumer data privacy laws have all used the same basic bill template that was developed by a state senator named Reuven Carlisle in the state of Washington. And so you have a consistent set of basic consumer rights related to data privacy across 19 states acting in our role as laboratories of democracy. And with respect to AI, and some of the presentations yesterday were just absolutely excellent. The emerging AI in healthcare was especially good from my perspective. But when I first took on data privacy as a subject 6 years ago, everybody told me the first person you've got to talk to is Professor Bill McGivern at the University of Minnesota Law School. Bill's now the dean of the law school there, but what was most important at that point is he had written the textbook on data protection, data privacy law that was literally used in 20 law schools around the country. And I'm glad he was my first stop, because the key point that he made to me was, look, Steve, if you're going to be legislating in the technology field, the key point is don't legislate the technology. It changes too fast. Regulate the use cases for the technology instead. And those words are words that I've taken to heart. The example that he used, which actually came up at one of the presentations yesterday, Rod was the one who brought it up, is that he said, look back to 100 years to the transition from horses to cars. So the dean of the architecture school, Tom Fisher, has this PowerPoint where one slide, the first slide is a picture of Hennepin Avenue in 1910, all horses. Same picture on the second slide, 1920, all cars. And Bill said, this whole transition, occurred over a single decade. The laws, tort laws couldn't keep up. And so what the courts did is they simply treated cars as if they were horses. He said, Steve, if you're going to legislate in technology, you have to make sure that the laws that you write are robust enough to withstand that level of technological change. And so in my own legislation, there are legislators in other states that are trying to, for example, just one of the key use cases that is most controversial is automated decision making using artificial intelligence. And my approach to that is that, a lot of the technologies that are used for automated decision making is described by Professor Alafarish yesterday. He pointed out there's a continuum of different approaches, each of which provides different levels of transparency in terms of the variables and the confidence in the approaches. So I basically said I'm not going to write a bill like Bill Rodriguez did in Colorado that regulates the use of artificial intelligence using the NIST definition to make automated decisions. Within the state data privacy framework that is in use in 19 states already, there is a concept of profiling, which is the archetype is your credit report. Where your data is being used to make judgments about you. And there is the concept in our state data privacy laws in 19 states that says of consequential legal decisions. It's decisions about employment, insurance, finances, healthcare. And so instead of writing a whole separate bill about artificial intelligence for automated decision making, I just added a paragraph in my data privacy bill, which already regulates discriminatory uses of your data, whatnot, that says, look, if your data is used to profile you in furtherance of some decision related to employment, insurance, healthcare, housing, then you have a right to see the data that was used to profile you. If you find errors, you have the right to have those errors corrected and the model rerun to rescore you. And you have a right to have a plain English language explanation of why the model produced the result it did and what you might have done differently in order to improve your score the next time around. So all I did is I took the rights that we all already enjoy under the Fair Credit Reporting Act with respect to our credit scores and made them applicable to all of these other kinds of important decisions. And you will probably never see me write a piece of legislation that uses the words artificial intelligence in them, because I think the boundary between artificial intelligence and other kinds of statistical decision making is so blurry as to be indefinable and non-judiciable.
So, Katie, I'll come back to you. Some of the legislative language that you're following, coming back to Representative Steve Elkin's point that he's not mentioning AI in the legislation directly because he's focusing more on the use case approach. What kind of language are you seeing emerge in your conversations and what you're seeing in Washington, D.C.?
Yeah, so there is a lot of the legislation does mention AI specifically, and around mostly some of the bipartisan pieces that have been introduced are around how AI can be used in AI-enabled tools can get like Medicare reimbursement, things like that. Congress has tried for quite some time to pass a national privacy law, and that has not come to fruition yet. In it, certainly there are similar discussions, I think more use case based, but that has not been, they haven't been able to pass a bill. In terms of kind of like ethical frameworks, or I think people are mentioning AI specifically and talking about how to regulate artificial intelligence. There's also, again, how does government regulate AI? how, does the FDA or CMS, do they have the authorities that already exist? Can we take existing authorities and, purpose them to artificial intelligence, or do we have to, evolve beyond that? And so I think that a lot of lawmakers at the federal level also are taking the position of, don't regulate based off of this specific thing because of the pace.
I want to open the floor for questions, and we'll have the mics for you in a moment. I can see a hand over there, one over there. Come on over. Can we start here and then we'll come back to you, Professor? You're next, and then number 3.
So this question is regarding kind of what you said earlier regarding least access, right? So some healthcare system gives their physician basically unrestricted access to all the EMRs, and some others restricted to the patients that they are treating, right? And so with the implementation of AI, what you could happen is that you could have these scrapers running along and then basically feed select physician all this information about like what tens of thousands of patients. And I'm just curious, what do you guys think about that? And are there any, anything that's coming along that you feel like is addressing that potential issue?
Yeah, I can address that. So under HIPAA, patient data is already pretty well protected. The examples that Senator Lucero, used of, nurses snooping into celebrity health records, that's illegal under HIPAA, and people get fired for that all the time. So for healthcare research, anonymized data can be used and shared as long as there's no PII, and there's a lot of controversy about what constitutes re-identifiable information. In my data privacy law, I included provisions that explicitly make it illegal to re-identify de-identified or pseudonymous data. That's an important protection, and nobody in industry pushed back on those provisions.
So if the algorithm, if AI is seeking, if there are many applications obviously, but if the application, let's say, is to evaluate information to try to make a more precise conclusion or recommendation or surgery type or prescription or et cetera. And you bring up a real point that if on one patient, let's say, not de-identified data on 10,000 patients, but on one patient, if the system has an incomplete picture of the full record, if only a portion of that was accessible, yeah, it's very real that a non-precise recommendation will be the result, right? Because you do need all the information to make the best decision possible. And we do that as humans, and artificial intelligence are going to be exactly the same. And so that absolutely is, there's a risk for I can see the principle of least privilege being an interference for sure towards the best possible outcome.
Commissioner?
I was just going to chime in. It's a great question. Definitely not an answer or a solution for the question that you raised. But, I think throughout mankind, humans have always sought improvements in healthcare opportunities that like improve someone's quality of life, or maybe improve the longevity of someone's life, right? And we continue to see that, and certainly it feels like the innovations that we see in this space stand to be a potential pretty significant contributor towards that end. One of the concerns that I think really exists is, and we see this in the commercialization of this space. If you think about the tools that we access, they frequently come with subscription costs now, right? And so we see these tremendous inequities already created in society related to who can ask ChatGPT a question, related to how do I, or how should I interpret this, or what should I do? And if I have the means and the financial to, purchase a subscription, then, I may get better information. One of the things that, certainly is a, hopefully an outcome we avoid is inequities in healthcare related to I have a health plan of a certain level, that leverages AI to improve my health outcomes and other innovations, and others that don't have access to that. And so that democratization and access as it relates to these tools and the ability to help people in an equitable, fair way that maybe makes sure that all of our society has access to healthcare as it relates to how these tools can assist in that, certainly is really important.
Thank you. I have another question
Can
over
I
here.
add just a little bit to that? So, one of the biggest areas of concern, especially with respect to automated decision making, is algorithmic bias. But I think, as we heard in some of the presentations yesterday as well, I think a key point is that the mathematical models themselves are not inherently biased. They acquire their biases by choices that are made about which data to include or exclude, from the databases that are used to train the models. And a good example a case a few years ago, the United Health Group allowed a couple of researchers to come in and do an evaluation of one of their risk stratification models for evidence of bias. And the researchers were allowed to connect the claims data, which is the primary source of health information that an insurance company has, with their membership records, which included, in some cases, volunteered information about the race and ethnicity of the patient. And they found that the model was, in fact, producing biased results. People of color were not being identified as needing higher levels of care in the expected amounts. And when they dug deeper, what they realized is that because the model was trained on data that included primary care visits, and people of color were not getting their primary care visits in many cases, that the diagnoses that triggered the model's recommendations just wasn't there. It wasn't anything intentional, but the exclusion of that data from the database that the risk stratification model was trained on resulted in biased results.
Next question.
Okay, so this is a question to the panel in general, but specifically to you, Senator. As a cybersecurity expert, you know more than most that the biggest threat at this point to people is through social engineering attacks, phishing attacks, where people, they trust. Okay, so the point is that also, given that how people don't read all these long pieces of information in short, small font and just say, I agree, that people are not getting informed. So the whole idea of consent really is all about informed consent, right? So today, when we are giving consent or not giving consent, it is uninformed consent, right? So we just don't know. And what AI is doing is that not only is that I'm giving an uninformed, by pressing that I agree, I'm giving the uninformed consent not just to my data, but to the level of analysis of it, which is unprecedented, right? So the point is that given the fact that we are all giving uninformed consent, and therefore our risk and exposure, Gopal, you use the term liberated, the data is getting liberated, but that, liberated without any, vaccination, if you will, to the viruses out there, okay? So is that true liberation? So in this context, do you think, and again, this is to the panel, from a legislative perspective, that moving from opt-out to opt-in is the right approach? Because then the government and the legislation is going to provide a guardrail, just as Europe has done. So is that the right approach?
Boy, that's music to my ears. I have been pushing to have a requirement for an opt-in. So right now, across the board in vast majority of contexts, it is assumed consent is given, and the effort is to opt yourself out. I vehemently disagree with that. I'm one that's been pushing in the legislature, and I know Rep. Elkins knows this, and I honestly can't remember where you fall on this.
No,
question.
we have some provisions, but go ahead.
Okay,
I'll follow up.
So I have been pushing in these various contexts to get away. So instead of assuming that consent is given and the burden is to opt out, to instead assume that consent is not given, and it then becomes the burden of the entity to gain affirmative consent. But so even if that's given, even if that were to occur, that doesn't solve the larger question, which, as you said, is the objective is to have informed consent. And even though there's a burden now to opt in, that doesn't necessarily mean they're informed. They might be doing it, and I'm just as guilty as probably most in here. Scroll to the bottom, click it, because I'm in a hurry, and I got to get to the next page and do on, whatever I'm doing. I have consented now, and maybe that satisfies a legal requirement, but no, it's, as a policymaker, when I think of the population, there is no legislative fix to force the population to care. When I mean to care is to inform themselves. There's no way to solve that. But the next best thing I can do is at least push the affirmative consent to opt in.
So within the general state data privacy framework that's in effect in 19 states, there is a categorization of data as a class of data referred to as sensitive personal data that includes our precise geolocation data, and health and biometric data. And for sensitive personal data, and I have a bill right now that I'm hoping to pass next year that would include all of the health data that's collected from applications and devices that isn't covered by HIPAA, categorize that as sensitive personal data. That is already under these state laws opt-in. So companies do have to have your express consent before they can share or sell your data. And for all other personal data that's not sensitive, there is a universal opt-out mechanism. There's still work being done on the implementation, but you will be able to, in fact, if you have DuckDuckGo or Mozilla Firefox as your primary browser, within those browsers there is a setting that you can make even today that will universally opt out to the sharing or sale of your data.
Any other questions? Yes, you had one.
First, thank you for everything you're doing. I know how difficult it is to set the policy for something that I have been personally working with some of the businesses to set up the enterprise governance simply to keep the right balance between creativity and chaos. But that's nothing compared to what you're doing. But saying that, now if we believe even 50% of everything the people say about how the AI is going to impact the future of the nation, industry, everything. So do you think all these efforts going on at the federal level and the local level in terms of policy, is it really making the right balance between creativity, innovation, the future task force, and also use cases, and obviously making sure the bad actors do not access to some of these capabilities?
Yeah, I'll take that first, and others may want to weigh in as well. I think that the cooperative process that we're using at the state levels, where we have this large working group under the umbrella of the National Conference of State Legislators, where we're all comparing notes and adopting ideas that others have employed. And when I passed my data privacy law, there were provisions I took from Connecticut and Colorado and Oregon and Texas. I just saw a bulletin from a lawyer who follows this stuff about the new version of the law in Connecticut, which has kind of been a leader in this. And they just updated their bill and adopted provisions from 6 other states, including a couple of things that were unique in my bill. But I think that the process of states working as laboratories of democracy is working pretty well in this space right now. And it will continue to evolve, but in the absence of congressional action, affirmative action to protect either privacy rights or govern the use of artificial intelligence, this is an area where I think that the states are doing a pretty good job of collaborating with each other, developing ideas, testing ideas to see what works, and then adopting the best practices in an evolutionary manner.
So I graduated from Metropolitan State University, just down the road. That's where I got my 2 bachelors in law enforcement and the bachelor's of applied science in computer forensics. And so they have a special place in my heart. One of the things that I'm so excited that Metropolitan State University has been doing, I'm just lifting it up as one example. They have an innovation center. And so there's a recognition that cybersecurity, think 10-ish years ago, even 10-ish years ago, cybersecurity was obviously still incredibly important. And they stepped forward and they have been working on a legislative level. Eric, we need to create a center, an institute. And it's a cybersecurity institute now that they have. And what is the purpose of this? It's in the recognition that in the cybersecurity space, there are multiple stakeholders. And how do we bring together minds from the public sector, minds from the private sector? How do we bring in research and development dollars? How do we bring in different frameworks for application into one space to collaboratively work? And so that's what the Cybersecurity Institute has at Metro State. Now, if we were to one of the things I'm putting forward is, why reinvent the wheel? We could take that exact same model now and apply it to AI, because that's the challenge. How do we foster collaboration, innovation, research dollars that likely have to, obviously be contributed from government, in addition to the private sector? How do we bring these into one place? There's going to have to be the equivalent of what Metro State has stood up in the last 10 years and do so here. And we are in a prime area and time in Minnesota here, already a nationwide leader in healthcare. And among the leaders in the cyberspace, combining those two, we have a phenomenal opportunity to create an innovation center for artificial intelligence, to bring in those same stakeholders to produce something, weighing that balance between regulation, innovation, government, dollars, private sector, all those things, again, in one of these, patterned after a center, innovation center patterned after what we've already stood up.
Thank you, Senator Lucero, because that's exactly what we're looking to accomplish in these 1.5 and 3-day conference over here, focused on AI. First 1.5 is focused on Health AI Institute, bringing in together all the components that you're talking about, so that we can make this into not just a place for conversation, but for action as well, for ideas and suggestions for lawmakers and policymakers and industry. And the next 1.5 over here at the AI Summit is going to be focusing more on technology from what University of Minnesota is doing, and which is a huge center, nationally recognized center for engineering, science, engineering, and technology. And given the depth and breadth of the multidisciplinary program that we have here at the university, it just is a perfect place to drop on all of these resources together. So thank you for saying that. Any other question? Last 2 questions, maybe one more.
My question is, so I appreciate my health information being kept private to the least privileged person that needs to diagnose me, but I also realize the benefit of anonymizing and aggregating data for AI purposes and general societal benefit. What are the laws around anonymizing and aggregating data? Do people have to consent to that, opt in, opt out, or can people just use it if it's been anonymized and aggregated?
Yeah, I would say under most state data privacy laws, data which has been anonymized or pseudonymized can be used in exchange. Because it can be, in some cases, really easy to re-identify anonymized data. I put a provision in my version of the law that's explicitly, expressly prohibits the identification of anonymized data.
So your current law, you're saying. So current law is de-identified data. There might be some exceptions, but for the most part, current law permits your de-identified data without your consent to then be shared.
Do we have time for a couple more questions, or Jaideep? Do we have time for more questions, or one more question? Last question, please.
Kind of building off of the last gentleman's comment, as a provider, I appreciate and want to have as much information about a patient as possible when I'm treating a patient. Feeding into that, though, and looking at privacy concerns and sharing of data, what are your thoughts on the NCPDP Experian enumeration of data across the country? Do you have any concerns about that or how it's being used?
I'm not familiar with that particular standard. I know what NCPDP, but I'm not familiar with this particular standard.
Okay, maybe we can talk later.
Thank you so much. This was an exciting conversation. Senator Lucero, Representative Elkins. There's one more question. Okay, Steve Guest said.
Real quick, this has been a fantastic discussion, and I really liked what you said about regulating the use cases. One use case I'm worried about is loss of jobs due to AI, right? We've been talking about the technology, but that's going to be a huge impact. And I just was wondering if there's any initial thoughts, discussions, anything on that subject.
So if we've got a few minutes here.
Yeah.
So I'm just going to use the example that we discussed earlier. And so it's going to be stepping outside of the context of healthcare, just to illustrate this point, though. Workforce issues have absolutely risen to the legislative level. We've discussed that. I think it was in I'm a member of the Education Finance Committee. We've even had that discussion in Education Finance and in the Energy Committee also. But the example that I saw, and maybe some of you have seen this. I have no doubt some of you have seen this. On social media, maybe 6 months ago or so, I saw it was just scrolling through the feed, and I saw it was a video, what appeared to be some kind of a coffee shop. I don't know what it was, Starbucks. I have no idea what it was, and I don't know where it was in the country. But it was a video of a coffee shop, and right down the middle of the screen, on the left-hand side were the customers. At the tables, you get your bagel, your coffee, you're sitting at the table. On the right-hand side, you have the counter, the service counter, the registers, and then the employees behind. You have the coffee grinding machine and all that stuff. And there were probably, I think, 3 or 4 employees, and there were maybe like 6 or 7 customers. And what this camera had is it had a little ticker above each head of every person in there. How long the customer had been sitting there, taking up space at the table, right? In the finite number of seats available to sit, how long the customers had been there. On the other side, it was tracking the employees and how efficient they were. And you could see so it was AI tracking how efficient this employee is able to serve more customers in the same amount of time than this employee was. And just very minor use case here on a workforce issue, but that concern, what are the regulations about that? Is it the grading on a curve? Grading on a curve, somebody's guaranteed to fail. So are you just going to eliminate the bottom person no matter what? Think of the implications of that as we apply that across the board, and certainly AI from that perspective. But then we also know that the artificial intelligence is going to have an impact then on traditionally white-collar jobs. Right? Lawyers, accountants, think of all the middle management where your job is simply a paper pusher and to make decisions. If that's all you do is you're getting paid to make decisions based on analysis of some information, you're easily replaced as we advance. So are there going to be workforce issues? 100%.
And I can say
please.
that they're thinking about this at the federal level. There have been several hearings talking about workforce, again, AI writ large, not specifically in healthcare. BPC also has a working group that's looking at AI and workforce as part of our human capital. So I'm happy to send you some of our thinking on that as well. We have a task force and we're looking at it, talking about what does that transition look like what does upskilling folks, who are able to maybe use AI, how do we have kind of that transition for people? So it has definitely risen to the federal level as well. And there is a lot of excitement, but also a lot of concern about what that would look like across so many different sectors.
On that encouraging note, thank you so much, Katie. Thank you so much, Commissioner. Thank you, Representative. Thank you, Senator. And round of big applause for these wonderful guests over here today. Thank you so much. And thanks to all of you.